So there's another picture that I want to show our viewers. Oh, wow, look at that.
This is laser therapy. So this is laser only. This is a laser only patient who used an at-home device for 1 year. So again, remember we said 1/3 of a millimeter a day or 1/4 of an inch a month. So this is not going to happen overnight. Now, she was born and still has thin, quality hair, but you can see those weak, thin, wispy hairs were rejuvenated a lot in the frontal area of the scalp. She had a beautiful result from low-level laser therapy only.
And can you imagine how much better she felt? Like we talked about that, you know? Looking in the mirror and feel good about yourself.
Absolutely.
That's what counts. Okay, I think we have one more picture, and let's show this before and after. And I think this is the area that happens to women as they get older. It's that separation.
Correct. So women's hair loss looks different than men. As we see a widening part line. The hairline stays the same. We see that very often in our patients where they have this widening part line effect from the thinning, weaker, wispier hairs. This is a PRP treatment. So this is that vampire hair treatment that I just mentioned to you, done in the office, comfortable, and no recovery time, no downtime. It's a lunch hour treatment, platelet-rich plasma. We do it in a very special way that enables the results to last a full year, maybe even longer, which is that's not too common. Many people out there are doing PRP, but all PRP is not created equal. You've got to go to a specialist, and we'll tell you exactly how many platelets are in your PRP, and we'll do it in a sophisticated way.